Dr. Kaye Bender. Kaye is just a extraordinary public health leader. She's a mentor, she's a leader, she's a friend, and Kaye has just done so much. When I first met Kaye Bender, when I came to public health in the mid-90s, and at that time I knew nothing really about public health. I was the district social work supervisor, and Kaye really understood what social work meant in public health. And she has always just helped everyone that she worked with in terms of being available, in terms of her honesty, her commitment, her leadership, and she has always done that. Her availability, I think, is the thing that's most important. When I came, as I said, she was the Deputy State Health Officer, and she was always available though. She was available to her team. She encouraged teamwork. There was never a time that we called or asked her for some information or some guidance that she didn't have the time. Then when she went on to become the Dean of Nursing over at UMC, she still was always available. If we called or if I called and said, Kaye, I just need to run something by you, she had the time. She took the time.
I'd like to tell you that she started as a candy striper in high school, and she loved public health. She loved health. She loved taking care of people. That was her claim to fame.
Well, Kaye, we've come a long way, babe. I remember you when you were a county health department nurse in Hinds County. You had just come up from Jones County, so you truly were a girl of the country. You came up, you worked as a staff nurse, you climbed the ladder, ended up as chief nurse, and then even you held the position of Deputy State Health Officer, which had never been done by a nurse at all.
Kaye's major accomplishment, I think, for the country is when she went to Washington and they worked with the Senate, worked with politicians, trying to get them to understand how important it would be to accredit each state in the United States, accredit them, go through a process that's very rigid, and it meets certain standards, and until you meet those standards and it's passed on by a panel of physicians, you couldn't acquire that.
So when Kaye left the Department of Health and went into other endeavors in her career, she was still just as passionate about public health. She left her mark everywhere she went. Regardless of the role she served in other jobs, she was constantly thinking about public health and how all areas of public health could change the lives of people in Mississippi and all states.
She taught us process. She taught us how to work through the process, how to assess, and just was an awesome leader, mentor, and most importantly, and what I really appreciate, is that she is my friend.
Everything you did, you earned, but yet you maintain that personable personality that you have. You could talk to anybody and you would, and that is a huge thing. I want to say congratulations and carry on.